Hey everybody, welcome back to Daytime. Dr. Ron Nussbaum is back on the show. He's the CEO of Back Clinics of Canada. Welcome back to the show, sir.
Thank you. Nice to see you guys again.
A pleasure to have you on the show. And it doesn't really matter what age you are. If you start struggling with a bad back, you notice it right away.
100%.
What are some of the services that the Back Clinics of Canada are working on now? Because you guys are cutting the way, or leading the way. That's
cutting edge.
Cutting edge, leading the way, trailblazers.
You got it.
Something else that sounds good when it comes to making your back better. You've brought some of your great equipment in, but before we get there, I want to talk to you about the advancements and the things that you are now doing in your clinics.
So before we can actually talk about advancements, we have to talk about what led up to advancements, what drove the search for advancements. Up until recently, there was pretty much the same old. So you have family doctors dealing for back pains, you have chiropractic doctors, you have physiotherapists, you have athletic therapists, you have yoga instructors and so on, and they all do fantastic work. And they all can actually help with certain kinds of problems. But the problems that we faced was there was a certain segment of patients that wouldn't respond to traditional forms of care. So we had to ask the question, what exactly were these problems? Why weren't they responding? So what do we have to do to develop something new to address these particular problems, which is a nice segue into, well, what are those problems?
What are those problems, Doctor?
Well, you've got a spine there,
It's funny that you should ask. This is unbelievable. So, of course, back pain is a big deal. It affects 4 to 5 Canadians between the ages of 30 to 50 years of age. In terms of severe back pain.
Now we're talking neck pain too?
Neck pain and back pain as well.
Issues.
So there are, there's sprains and there's strains, and we just saw a little bit of snowfall, and people are starting to almost get ready, and hopefully in a future episode we'll talk about proper shoveling etiquette and so on. But we're not talking about the garden variety simple stuff, because those are the things that most people respond very well with conventional forms of care, and especially chiropractic care. But we're talking about advanced forms of back problems and neck problems, and they really fall into the category of either bulging discs, herniated discs. Anyone want to take a guess?
Crushed disc, is that a term?
Well, no, but we can pretend.
Okay.
Degenerative discs.
Okay.
So you want me to show you quickly what they are?
Absolutely.
Okay, so here, which camera are we at?
Let's turn it out just a little bit that way.
Okay,
Beautiful.
ready for here?
Yeah.
So this is a spine, and these are the bones. We call them vertebrae. And between the vertebrae are these shock-absorbing pads. Elaine, you want to take a guess what they're called?
Cartilage.
Right, they're made of cartilage, but they are the discs.
Right.
Because they're disc-shaped. So the purpose of these discs, I don't know if you can see where my finger is, this disc, the height of this disc, is to take pressure off of the segment so the nerve, this yellow nerve that comes out, doesn't
Which causes the pain, the nerve.
Well, yeah, but the nerve carries the pain.
Right.
So what we want to make sure is that the height of this disc should always be nice and high. I don't know if you can see that.
Yeah.
If the disc starts to thin because of wear and tear, that's called degenerative disc disease. Okay. Or spinal arthritis.
What's the most common reasons why you get wear and tear? Like for someone who, Jeff is a young guy, why should he have wear and tear so young? Did you have an accident?
Yes. Yeah, car accident.
You guys don't even need me because that's perfect.
Yeah.
This is exactly
Beautiful.
it.
Yeah.
So slip and fall, sports injuries, repetitive strain, these kinds of things will traumatize the disc, and they create inflammation that causes a weakening of the disc, and it loses water, and that's what will cause the disc to get thinner. When the disc gets thinner, what do you think happens to the size, the opening where that nerve comes out of it?
Starts to rub together.
It's going to get smaller, so it's going to start rubbing on the nerve. So that's degenerative disc, and it's also called stenosis. The second problem is where, facing this camera?
Yeah, that's good.
So if you look at the center of this disc, you got this jelly part, and you got all these rings. If one of these rings should tear or stretch, it's going to allow this gel, which is under pressure, to move offside. So instead of having a nice, yummy-looking disc like this, you get a bulging disc like this. That's nasty.
That's not good.
No, that's a bulging or a herniated disc.
Yeah. So listen, we're going to take a break.
Okay.
When we come back from the break,
we'll explain it all.
Beautiful. All right, guys. Backclinics.ca. It's my first day back. Can you tell? We'll be right back with more.